Universal health coverage, or what we like to call UHC, is a state in which all people who need health services are able to get them without necessarily suffering from financial consequences of paying for health care. It's a really interesting question how COVID-19 may actually affect whether or not people are able to get the services they need and how much it's going to cost them. And I don't think we have a full answer to that question yet. However, I think countries that do a better job in terms of providing UHC to its citizens are likely to do a little bit better than those that don't. But that's not the whole story. We may want to dig a little deeper. For example, even countries that do have universal health coverage, some of them rely on, for example, tax financing to support their health systems. And others rely upon other forms of financing, such as social health insurance or private health insurance, to achieve the same result. Tax financing is probably something that is likely to be more stable, and governments are likely to have more control over it. So when the outbreak happens and the response happens, governments are probably going to be able to fill in the gaps a bit more if they rely upon tax financing. One of the things that we've seen happen in many countries around the world over the last couple of weeks is a number of people losing their jobs as a result of some of the public health and social distancing measures that have been put into place. And if you get your health insurance through your job, some of those places are likely to suffer more. And so I think there's a need to think about tax financing to fill in the gaps to ensure universal health coverage is met, even in places that had it before. Some places, of course, don't do a great job at ensuring that their citizens have UHC, and those countries will clearly do worse than others. In particular, places where people are required to pay a lot for health services. We might, for example, see people reluctant to come in to get tested. And so it's really important that we ensure that people don't have to pay out of pocket to get a test, for example, so that people aren't discouraged from coming in. And then once people do come in, that they're guaranteed to get their services covered so that they're not faced with this huge bill for paying for the care that they received. Ooh, I think this is a really great question, but I think it's too early to be able to put a dollar figure on whether or not healthcare costs are going to go up or go down because of all this. So first off, it's really clear the number of patients presenting for COVID-related illnesses is new, and that's going to have to put a strain on our healthcare system. In particular, the costs associated with ICU beds and critical care beds. Those are all going to have to be factored into this. But the other thing that's happened that is worth mentioning is that because of the public health measures that we've put in, we've actually seen pretty significant changes in terms of what people are presenting at clinics and hospitals for. For example, at this time of the year, we would normally see a lot of cases of influenza here in Hong Kong. However, because of these public health measures, whether it be hand washing or social distancing, we've actually seen a measurable decline in terms of the number of influenza cases. And so in some cases, we've actually seen a decline in the utilization of health services. However, I think it's also worth mentioning that the massive shift that's happening in all of our lives right now is probably also influencing other healthcare costs in ways that we may not have been able to predict or fully understand yet. For example, a lot of countries are reporting decreases in car accidents because people aren't going out and driving as much. We've seen increases in rates of mental health issues, and it's unclear what consequences that might have on the health system. We've also seen, for example, people having things like heart attacks and strokes presenting late. And so it's unclear whether or not that's having a positive or negative impact on total healthcare costs because people are not necessarily getting timely care when they need it. And there's other interesting shifts that have been observed, and we haven't been able to fully account for this. For example, in places like China, when the outbreak was at its peak, people were finding new ways of seeking healthcare altogether. For example, we saw a large proportion of services that would normally be delivered in clinics being delivered online through telehealth platforms, and we've seen reports of this happening around the world. And so it's really too soon to say what the overall impact is going to have in terms of total healthcare dollars. I think what is clear is making investments into our health system are critically important at this time. And so not making decisions that are based on limited budgets as opposed to trying to optimize about the new scenario that we're in is really critical at this time. I wish the answer to that question was yes. The reality is that we are in a whole new world in terms of thinking about how to respond to this outbreak. It's only been 3 months since we've really seen major government responses to the outbreak. And we've seen an enormous proliferation in terms of the types and scope of policies that countries are adopting around the world. And I think it's really too soon to say whether or not all of these policies are working. In particular, many of the policies get implemented at the same time, so it's very difficult to say whether it's this policy that's having an effect or that policy that's having an effect. And the complexity of the amount of different policies that are being introduced is unbelievable. I think it's fair to say that we have not seen this level of government response to any type of major event, probably going back in history as far back as the World Wars or potentially even longer. And so we're still very much in a learning phase in terms of our understanding about what works and what doesn't work. I think there's a really important role for academics and others to be playing right now, to be trying to evaluate what impact these policies are having, both in terms of what impact they're having on public health, but what impact they're having on social and economic outcomes as well. And this means finding ways of providing in real-time short-term evaluations of these types of policies, as well as also thinking through what the long-term effect of many of these policies may be.